Hello, everyone. We all must advocate for ambitious improvements in world health. But we cannot achieve health for all if we don't know who we are leaving behind. Two words, measurable impact, are integral to WHO's transformation and its strategy, the 13th General Program of Work, which leads us to use data and evidence to deliver impact. The impact measurement is designed to get us working together and to give us clear focus on a common goal. More than a mechanism to measure progress, it is a powerful catalyst for us all to achieve the Sustainable Development Goals and ultimately a healthier world. There are many aspects to this shared work. Setting goals, tracking progress, and problem solving while constantly learning and sharing best practices to ensure no one is left behind. But everything leads to one common goal, that is, delivering impact in countries. Our focus is on using timely, reliable, and actionable data to improve the health of billions of people. The triple billion targets are fundamental to how this plan will be achieved and monitored. The outcome of the triple billion is a tangible number, a number relatable to human lives, a number that can drive change. Crucially, the triple billions help countries to deliver on the Sustainable Development Goals. And I now pass on to my colleague, Dr. Somnath Chatterjee.
In 2019, WHO Director General Dr. Tedros Ghebreyesus reminded WHO that the triple billion targets are about changing the DNA of the organization to deliver a measurable impact on the lives of the people we serve. But the GPW 13 and the triple billions approach will only be of value if they are tied to interventions that drive impact within countries. The GPW 13 results framework enables WHO to measure progress at all levels of the organization, focusing on the impact it has on people's lives. The impact measurement framework is one component. It's a system designed to measure health impact in a way that enables the tracking of progress. Another component is country case studies. These paint a qualitative picture of WHO's impact and give the data a human face. The third component is the output scorecard, which assesses WHO's contribution to impact across 6 dimensions of technical support, leadership, and normative work. Together, these 3 components feed into each other in a virtuous circle whereby success in one component should lead to success in the others. We will now focus on the impact measurement component in more depth. The impact measurement framework measures progress at 3 levels. 46 outcome indicators monitor progress across a range of health issues. The triple billion targets to be achieved by 2023, these aim for 1 billion more people to benefit from universal health coverage, 1 billion more people to be better protected from health emergencies, and 1 billion more people to enjoy better health and well-being. The overall health of populations is measured using healthy life expectancy, or HALE, which quantifies the expected number of years of life spent in good health. The triple billion dashboard is a tool that regions, countries, and partners can use to accurately track and improve progress towards the triple billion targets and outcome indicators. Its dynamic and interactive visualizations make the data both accessible to the user and applicable to the task of drawing up national health policies and interventions. Let's now take a closer look at each of the levels of the impact framework in turn, starting with the bottom layer, the 46 outcome indicators. These were selected by the WHO technical programs and approved by the World Health Assembly in 2019 after extensive consultation with member states and review by partners. Of the 46 outcome indicators, 39 have been taken from the SDG indicators. They cover a range of topics, all of which impact on health. In addition, 7 non-SDG indicators monitor emerging health topics that have been identified as priorities by member states. These include communicable and non-communicable diseases, obesity, health emergencies, and antimicrobial resistance. A key objective of the 46 outcome indicators is to benefit priority subgroups in a population and to reduce health inequalities within countries. So, to monitor this, each outcome indicator will be disaggregated or broken down into at least one dimension of inequality: age, sex, urban or rural location, economic status, or education. Each member state selects which outcome indicators to prioritize to drive impact according to its population's health needs. A member state, for instance, select outcome indicators related to SDGs 2, 4, and 6. They would then identify a dimension of inequality for each outcome indicator and at least one priority subgroup. The situation of the priority subgroup would be monitored alongside the national average to show how the subgroups are performing compared to the population overall to ensure an overall reduction of inequality. Each of the 46 outcome indicators is monitored in the triple billion dashboard via the indicators page. The indicator level dashboards include disaggregated data for equity monitoring wherever this is available. The outcome indicators contribute to the triple billion targets, which is the next level in the impact measurement. The triple billion approach provides a strategy to measure the health-related changes that result from interventions and improvements. These changes might relate to health coverage, health emergency protection, or to people's health and well-being. There are many ways in which to estimate the changes brought about by the triple billion approach. WHO has opted for relatively straightforward methodologies that focus on SDG indicators to avoid the need for extra data reporting. The quality of data and its availability has also been taken into account. And most importantly, WHO wants to encourage ownership and engagement by member states. Countries of every size are equally important in the triple billion methodologies. Country contributions to the triple billions will be reported both as a percentage of the country's population and as the total number of people whose lives have been improved. Each of the triple billion targets will be measured using an index which is composed of several indicators. The UHC billion is based on the SDG outcome indicators relating to universal health coverage and financial hardship. For the Health Emergencies Protection Billion, 3 health emergency outcome indicators are used to calculate the billion: prepare, prevent, and detect and respond. For the healthier population, 16 component indicators are selected from the outcome indicators. We will now look briefly at how each of the indices is formulated. The Universal Health Coverage Billion is based on three components: service coverage, measured as the average proportion of essential health services provided to its population, calculated from 14 tracer indicators. The proportion of people receiving health care without incurring financial hardship, and the proportion of the population covered by health services. All three components are combined to calculate the universal health coverage single measure, the proportion of people accessing service coverage without financial hardship. To calculate progress against the UHC billion target, we look at change in UHC proportion between the baseline year of 2018 and the target year of 2023. The Health Emergencies Protection Billion will be measured using an index built from three indicators that capture the scope of WHO's emergency activities. The Emergency Prepare Indicator, how prepared countries are for health emergencies. This is measured using 13 international health regulation capacities. The Emergency Prevent Indicator, the prevention of epidemics and pandemics. This is measured by the vaccine coverage of at-risk groups for epidemic or pandemic-prone diseases. The Emergency Detect and Respond Indicator. This measures whether health emergencies are rapidly detected and responded to. These three indicators are averaged to create the Health Emergency Protection Index, which is then categorized into 5 levels. The aim is for countries to work towards moving up a level. To calculate progress against the Health Emergencies Protection Billion target, we look at the sum of the percentage changes in each indicator between the baseline year of 2018 and the target year of 2023. Measurement of the healthier populations billion involves counting the number of people who have benefited in one or more ways from changes related to environmental, behavioral, and socially linked health risk factors. The measurement is built on 16 of the GPW 13 indicators, which cover safe water and sanitation, clean air, alcohol and tobacco use, domestic violence, child nutrition and child development, obesity and trans fats, mental health, and road safety. All but 2 of these are SDG indicators. The Healthier Lives approach adds up lives by counting people who have become healthier. Negative contributions to the billions can occur if an indicator has deteriorated over time. Let's bring all this together in an example. Imagine a country with a population of 106 million in 2023, the target year for the triple billions. For the UHC billion, if UHC coverage in the country was 44% in 2018 and is 50% in 2023, there has been a change of 6 percentage points. 6% of 106 million represents 6.4 million people enjoying universal health coverage. For the Health Emergencies Protection Billion, if the country's Prepare indicator improved by 5 percentage points, the Prevent indicator improved by 2, and the Detect and Respond indicator improved by 3, the total improvement by 2023 would be 10%. This represents 10.6 million more lives protected. For the Healthier Population Billion, the number of healthier lives is calculated for each tracer indicator. For example, if 2.6% fewer children suffering from stunting, and the under 5 population in 2023 is 8.4 million, then 0.22 million children have been saved from stunting. If the proportion of people with access to safe sanitation increases by 4.5% by 2023, then 4.77 million more people will be enjoying this facility and the health benefits it brings. But if 1.7% of adults have started using tobacco by 2023, then there will be 1.46 million people who are likely to be less healthy. The sum of the newly healthy and the newly unhealthy lives in 2023 is then 3.5 million. More detailed information about how each triple billion is measured is available in the Methods for Impact Measurement report presented in the Tools and Further Information section at the end of this video. Global and country-level progress against each of the triple billion targets, including the underlying indicators that are used to calculate each billion, are available in the triple billion dashboard. The triple billion dashboard also includes 3 scenario tools where countries can input national data values and projections for the triple billion indicators and view what the impact would be to each of the billion contribution. Healthy life expectancy, shortened to HALE, quantifies the expected years of life in good health a person might expect. HALE is a summary measure of the overall health of a population. It is used within GPW 13 as an overarching and comparable measure that monitors the overall progress made in achieving the triple billion targets. HALE is currently reported annually as part of the WHO Global Health Estimates and also as part of the Global Burden of Disease. It is calculated using data from vital registration systems to allow estimation of death rates and national health examination surveys on the prevalence of diseases, injuries, and disabilities. Progress in HALE can also be monitored via the triple billion dashboard via the indicators page. The process of measurement exposes gaps in data and encourages the gathering of better data. It also promotes better understanding. This, in turn, provides future possibilities for more efficient measuring. So, measurement sets up a cycle of change with the potential to drive progress. Better measurement allows clearer choices to be made, more precise actions to be undertaken, and more lives to be improved. Countries will continue to work to identify ways to increase impact and improve people's lives in tangible ways. Counting the triple billions will encourage a series of positive changes through which we can hope to see accelerated improvements to the health of the world's people. We want to see more people covered by health care, protected from emergencies, and leading healthier lives. Our ultimate goal is to make sure that no country, no city, no community, no person is left behind. For more information, take a look at these additional resources.